I don't have to even leave forward. Ah, okay. 26th of January 2026. So nice to see you all. So we're going to start off with welcoming members of the committee. So I'm going to ask committee to introduce themselves, and then I'll ask officers to introduce themselves. So if we start from Kelvin and then we jump over and then go that way.
Thank you, Chair. Kelvin Blake, I'm Vice Chair of this committee, Labour Councillor for Hillfields Ward.
Hello, Lisa Durston, Labour Councillor for Filwood Ward.
Hi, Louis Martin, Labour Councillor for Froomvale Ward.
Councillor Joss Clark, Brislington West, Lib Dem.
Alan Grumpy, City Councillor for Froomvale.
Hi, George Kelly-Shawnee, Councillor for Clifton Down, Green.
Yeah, I think we all know each other, but Tim Y from Ashley.
Councillor Mark Weston, Henbury and Brentry.
Thank you. And if we start with you and then do the officers.
Yep, good afternoon all. Hugh Evans, Exec Director, Adults and Communities, Bristol City Council.
Oh, thank you. I couldn't see that button. Hi, Helen Pitches. I'm a Commissioning Manager in Adult Social Care.
Hello, Tom Wilson, Director of Adult Social Care Commissioning.
Hello, I'm Medley Jacobson, Director for Adult Social Care Operations.
Hi, I'm Bronwyn Faulkner. I'm the Policy Committee Officer.
And I am Councillor Lorraine Francis. I am Chair of Adult Social Care and Councillor in Eastville Ward. Okay, thanks everyone. So we are not expecting a fire alarm today, so if one goes off, then we need to evacuate. So we just lucky, we go straight out the main entrance, turn right down the ramp, and then we meet outside the cathedral. So if we hear an alarm, we're all going. So we will take a comfort break on the hour. So by 3 o'clock, if we've not done, we will take a quick 5-minute comfort break. Okay, so let's move on to agenda item number 2. So we have no apologies, which is great because everybody is present. So we're correct, so we can move forward. Okay, so agenda item 3 is declarations of interest. So does any committee members have any declarations of interest? I have Councillor Y.
Yeah, I mean, it's on my register, but I chair a care home charity which has got some placements from local authority, and as we're talking about providers, I thought I'd just mention it again.
Thank you. Councillor Blake.
Thank you, Lorraine. Yeah, I'm Chair of Second Step, so Second Step's been involved with the multi-disadvantaged work. So I think I'm going to go into the public gallery for item 7. Okay, thanks.
Oh, that'd be interesting. Thank you. Anyone? Okay, fabulous. So we'll note that. Let's move on to the minutes of the previous meeting, held on the 1st of December. I've read it. It appears correct. So does anybody have any queries? Okay, so would you like to second the minute? Thank
yes,
you.
I'd like to second.
Yeah, thank you. Thank you, Councillor Blake. Right, agenda item 4. This is Chair's announcements. I have no announcements today, but I'm sure I will after the budget one. So we'll just move on. No announcements for today. Okay, so agenda item 6. Excuse me, sorry, Councillor Galasoni.
Sorry, just a slight correction. Wasn't that item number 5?
What did I say?
You said 4.
Did I? Oh, okay. Item number 5. Thank you for the correction. Okay, moving forward to agenda item 6, which is public forum. So we did receive a question. The question has been answered, and the gentleman doesn't appear to be here. So we will move on. Thank you very much. Agenda item 7. So, funding and partnership plans for Bristol multiple disadvantaged work. So, I'm going to give Councillor Blake some time to move to the public gallery. I presume he needs to. So this report is to approve the delegation of authority for decisions on acceptance and spend of future grant monies 26-29 relating to the multiple disadvantages to the executive directors of adults and communities in consultation with the chair of Adult Social Care Committee. It's to update you on the positive aspects of the partnership work of the Change in Futures programme in Bristol and the role of the Multiple Disadvantage Transformation Board. So this is a key decision as it involves a spend of over 500k. So I'm going to invite Helen Pitchard to briefly outline the report, and then at the end of that report, obviously members, if you have any questions, then we can go through them. So Helen, I'll hand over to you.
Thank you very much. Okay, so the report explains the importance for Bristol City Council of addressing multiple disadvantage and sets out the key decisions, as Councillor Francis has just gone through, regarding funding and future governance. So the focus is on the Changing Futures programme and how we sustain the impact of that programme and align with the prevention and health improvement priorities of the City Council. So what is multiple disadvantage? Multiple disadvantage involves facing several linked issues like homelessness, mental health or substance use simultaneously. So individuals who experience 3 or more of those things. The impact of multiple disadvantage means that we can sometimes have very fragmented support systems for people, which can lead to repeated crises, increases in emergency costs and poorer outcomes for those individuals affected. So the Changing Future programme has shown how trauma-informed and person-centred care can really improve stability, trust and long-term success for individuals who've experienced multiple disadvantage in Bristol. And it can really help communities understand the need for ongoing investment to reduce inequalities and improve well-being. So the Changing Futures programme in Bristol has been supporting adults with multiple disadvantage and has been looking to kind of transform our kind of collaborative service delivery. In Bristol, we've taken forward an approach called My Team Around Me, which is very much creating a collaborative team around individuals where that person is the centre of their kind of care and support needs. And it ensures continuity for those individuals and shared accountability for the team that is around them. And they very much lead and are part of their kind of involvement in their care planning. So there's been a cohort of people under the Changing Futures programme that have been benefiting from that My Team Around Me approach. So to try and sustain that as a longer term approach, we've been looking to kind of move that model out from that kind of small cohort of individuals to kind of wider service delivery approach. So today, over 400 professionals have been trained in My Team Around Me from 50 plus different organisations across Bristol. And that's kind of really trying to foster that kind of collaborative approach and that early intervention culture with people experiencing multiple disadvantage. And Bristol has been really seen as part of the Changing Futures programme as kind of quite a national lead on addressing multiple disadvantage and influencing policy and system change. So we have seen some great success from the in that programme. We've seen improved individual, so on an individual basis for organisations and as from a system. We've seen improved individual outcomes. So there's been, for the cohort of people that were on the Changing Futures programme, we've seen significant reductions in rough sleeping for those individuals. We've seen individuals report improved quality of life. We've seen things like a decrease in violent crime experiences and fewer A&E attendances and the like. We've seen individuals' mental health and well-being improve, and as from a systems perspective, we've just seen greater cross-sector collaboration and improvement in things like workforce well-being for individuals who've been involved in that kind of My Team Around Me approach. And in the kind of National Changing Futures programme, we've seen some economic value and sustainability come through from that. So the programme has delivered really strong social and economic returns. For every pound that's invested, we've seen a £1.80 return on investment for those individuals who've gone through the programme. So, what does this mean for us in Bristol now? The Changing Futures programme is coming to an end. It ends in March 2026, and we know in Bristol that we will not be getting any more funding through that particular programme. So now we need some action kind of collectively to try and secure a sustainable approach to this work going forward and some strong governance to do that. You know, if we don't act at this point to kind of try and continue this learning, we'll risk really losing what we've gained over the past few years through the Changing Futures programme. There is a potential opportunity of future funding through a thing called the Community Help Partnerships, which is a Cabinet Office-led initiative. There could potentially be up to £100 million of investment nationally coming out through that funding opportunity. So this report is to ask us that should that funding become available, that Bristol could bid for it in the future. And we're looking to make sure that we continue that strategic alignment with both national and our local priorities to kind of leverage the cross-sector partnership working that's been going on as part of the Changing Futures programme to date. Sorry, apologies. So the decision-making, the part of the decision is that the Multiple Disadvantage Transformation Board, which is an existing board, City Council board, continues to work really collaboratively to bring that leadership into the City Council to ensure that we continue to kind of drive this work collectively. So on that board, we have local authority reps. Hugh is the chair of that board. We have adult social care. We have housing colleagues. We have public health colleagues on the board. From health, we have representatives from the Integrated Care Board and mental health services through AWP. And from the criminal justice sector, we have representation from both the police and the probation service. We have reps from the VCSE sector from mental health charities, homelessness charities, and there's lived experience reps also on that board. So the Multiple Disadvantage Transformation Board will look to continue to drive the work of the Changing Futures programme as the programme ends, and to drive that learning into those sectors to try and maintain the good work that's been going on. So the committee report, we're seeking approval should the Community Help Partnership funding become a real thing through the Cabinet Office, that we can put in a bid for that and accept that money and then delegate the authority to Hugh Evans and Councillor Francis as chair of this committee to manage any bids or spending or procurement that might come from that. We're looking for recognition and support for the Multiple Disadvantage Transformation Board as the governance body to kind of guide and oversee any future funded work and any non-funded work that collectively that as a city we put together. So I think that's it in a nutshell.
Right. Oh, thank you. Thank you very much. Now, I have a problem saying H's, so I'm going to say thank you, Helen, and I hope I pronounce. I really genuinely do. Yeah. So thank you for your presentation. So we're now going to open any questions out to members. If the members have any question, Councillor Clark has indicated that she has a question, followed by Councillor Y, and then followed by Councillor Durston. And I'm happy for us to just do the questions consecutive without me interrupting. So, Councillor Clark.
Thank you, Chair. I just wanted to find out about referral pathways in for the current project and also moving forward as the project opens up. Thank you.
So currently, because the programme has been coming to an end, you cannot refer into the Changing Futures programme as it is what has happened with the My Team Around Me approach is that we have some embedded workers alongside the CRG, which I can never remember what that stands for. It's the homelessness kind of group that looks at the most entrenched rough sleepers. And there's a worker who's working alongside MARAC, which is the domestic violence multi-agency approach. and also alongside the MASH, which is Adult Social Care's Safeguarding Hub. So they are working with workers who are out in the community to try and build those My Team Around Me around individuals who come through those kind of existing pathways that we already have in the council.
Thanks, Helen. It's obviously a great project. I suppose the thing that sort of frustrates me is having seen a number of these kind of grants that come to an end, and we prove that it saves money, but we're never able to kind of actually pull money out of more mainstream services to carry on funding. So I guess my question is, we might not get this extra grant. This grant will come to an end sometime anyway, so can we not build the evidence that's convincing enough to actually get housing, health, social care to put some money into it, if that 1 to 1.8 really is true and convincing? I know it takes lots to convince people to give up their budget to do this, but it seems like the evidence on this is quite strong. So it may not be a question for Helen particularly, but it's just, if we don't get the grant, how can we leave us some money? I mean, we were talking about Better Care Fund last week at Health and Wellbeing Board, and it's the frustrations about that not really being a proper pooled budget, just an amalgamation of stuff. But how do we sort of, you know what I'm asking? I'll shut up.
Helen, then, would you like? Okay.
Is it okay if I start with this one?
Mm-hmm.
Because I get, Councillor White, exactly where you're coming from, but the first point I'll draw you up on is proving it saves money, because the primary thing that this does is make a lot more sophisticated our understanding and awareness of the complexity of issues that some people who experience multiple disadvantage are facing on a day-to-day basis. And it has to be viewed system-wide, and the value of this work, and as Helen just described, the value of the kind of multiple disadvantage transformation board as we move forward, is that it is truly multi-agency. But the solutions to the issues around multiple disadvantage are absolutely multi-agency. So there are 2 or 3 angles to what you've said. The first one is that we need a multi-agency understanding of how the finance works in this context, because so many different parts of the statutory system have a stake in this. So if you looked at it purely from an adult social services perspective, our commitment of spend on the kind of people who might end up with multiple disadvantage support has increased significantly over the last 5-6 years. That's not just us, that's nationally. That's as a product of the mental health crisis. It's as a product of COVID and the cost of living crises that have kind of happened subsequently. So we've seen quite significant increases in the number of people who are resorting to acute sector mental health beds, and we're seeing significant increases in the number of people that we're seeing upon prison release, for example. We're seeing a lot more homelessness and all the other issues that are apparent with that. That's about us, that's about the NHS, that's about the police, probation, the criminal justice system more broadly. There's a whole, it goes via, it goes from children's into adults. It's the whole system has to be taken into consideration when we're looking at how much this costs and how best to address the needs of people. But what we've done with this work is we understand the needs of people so much more. I think there's a national debate to be had, and in the role that I've got in ADAS and the kind of conversations that we have with directors of social services across the country, I think there's a national debate to be had about the advent of the new homelessness problem that's happened over the last 15 years and the ways in which we're going to address that. The Multiple Disadvantage Transformation Board is really important because it brings together not only all of those agencies, but it brings together us in adult social care, it brings together children's and housing within the council so that we can mobilise our resources in order to look at housing solutions that best meet the needs of people that present with multiple disadvantage. Because otherwise we tend to see a lot more people in prison, we tend to see a lot more homelessness, we see more people in acute sector mental health beds, and we see our joint spend with the NHS under Section 117 of the Mental Health Act increase massively as it has been. So complicated, but we are lobbying very strongly for more resource, and I think that the Department of Health and Social Care and the Ministry for Housing, Communities and Local Government are talking together about how in the future they can address this, and we're going to keep pushing for it.
Do you want to add anything to that, Helen? Are you okay? That's fine. Councillor Dunstan and then Councillor Gallasconi.
Thank you. I've actually got 3 questions. Shall I ask them all in one go or one by one? Okay.
Yeah, I was going to say I might start with the.
They're not massively long. No.
Yeah.
Okay.
Yeah.
Yeah. Thanks. Great. So I suppose my first question is, what is the plan if you're not successful in the government grant? Is the government grant that you're referring to, is that the same as the 55 million multiple disadvantage funding that was announced by the MHCLG, or is that something else that could potentially be used for this work? My other question was around the partnership working and the criteria for the programme, which I recognise the criteria is kind of set at the national level, but it feels like there's a little bit of a gap specifically around sexual violence. So obviously domestic abuse is a key part of one of the experiencing domestic abuse is a key part of the criteria. Did you include sexual violence within that, or was that not a criteria at all, recognising that particularly childhood sexual abuse, for example, is a kind of key driver for multiple disadvantage?
To answer that last question, yes. I mean,
okay.
The definition is loose in Bristol.
Okay.
It'll be about how somebody's presenting, if you see what I mean.
Okay.
So we don't.
Rather,
we
they don't
go,
have to.
Yes, we don't go.
Be really strictly. Okay.
I mean, I think that's the whole approach of my team around me is we, referrals things sort of, we talk about shared safety planning and the like, rather than worrying about whether people meet thresholds and criteria. We're trying to move away from that really and see the person and what's going on for them and what's not working for them.
Brilliant.
In terms of the 55 million from the MHCLG, we know Bristol, we're not getting that. We are not getting any of that money because Bristol has improved in terms of our the deprivation indices. We've done better, so there's less deprivation in Bristol than there are elsewhere in the country. So that funding is only going to areas with the highest deprivation, which is why we're hopeful that when the money comes through, if money comes through from the Cabinet Office, that's where we will look to see if we can get some future funding. The Multiple Disadvantage Transformation Board exists and will continue to exist and isn't funding related. It's, that's like-minded people coming together to try and solve this for Bristol, and that will continue as a piece of work.
Great.
Just to add to that, I mean, just from an adult social services perspective, we spend tens of millions of pounds on work to support working age adults. It's more than half of our overall spend, so it's over £100 million. But there's a lot of other categories apart from multiple disadvantage. So there's quite a lot of money that we're committing, and other organisations are as well. It's how we organise what we commit that's going to make the biggest bang for the buck, really. Additional funding is useful because it gives us pump priming to do things, but actually the board is all about looking at what we always spend day to day, week by week.
Thank you. Sorry, I just had one more question.
I'm going to allow Councillor Calastoni. You can come back. That'll be 4. Okay.
Thank you. So my question was around the amount. So it's multiple. So it's free. Is that a national guidance, or can it be? I mean, multiple for me would mean 2 or more, not 3.
Yeah, I mean, that's what I was describing. If somebody is, say, for example, referred to the multi-agency MASH, the safeguarding hub, there isn't somebody going, have you got one? There isn't a form that goes tick, 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 tick. It's about that individual's needs and what impact that's having on their lives. If they're homeless, if they've experienced sexual violence, if they've experienced, and that means that they aren't able to, get the support that they need because the impact of their trauma means that they are, I don't know, been arrested for, you know, something. So we take the individual. We don't worry about, you know, tick boxes of meeting criteria.
Okay, thank you.
Right. Anybody else with any questions? If not, I'll go back to Councillor Durston. Okay, Councillor.
Thank you. It was really good to see. Sorry, I may be asking questions that have been asked at previous committees, but this is new to me. So the importance of trauma-informed practice in all the work that takes place. Are there any challenges, or how do you ensure that that kind of trauma-informed practice and awareness is really embedded in all of the kind of organisations? And I recognise some of the organisations, so I know that that is their whole kind of approach, really. But how do you kind of ensure that the training within those organisations to kind of make sure that approach is properly applied has taken place?
So there is a wider piece of work going across BNSSG, which is the trauma-informed kind of framework and practice. So we work really closely with Hazel Renouf, who's the lead of that, in terms of, you know, when, I don't know, if we're writing a service specification in housing for, you know, I don't know, a particular housing service or an adult social care service, we'll look to make sure that those principles are part of a service specification or part of the kind of performance framework for individual services that we might procure. So we've managed to embed that across some of the ways of working.
Okay, so everybody happy with their questions? Any last questions? Thank you very much, Helen, for your presentation. I believe you can go now. Unless you wanted to stay, of course.
Well, we'll need to do the
Right, I'm going to do it now. Oh, sorry, before you go. Sorry, the recommendation. I was just like getting drawn into this. I'm completely forgetting my role. Okay, so let me just finish off this bit. Okay, sorry, everybody. So just to clarify, for the members of the public presence and etc. and members, that the committee, one, approves submission of bids for the period 26 to 29, and if successful, acceptance of grant funding with support from finance officers to consider risk and associated financial implications, and in consultation with the Section 151 officer, which may be over the key decision threshold from the Cabinet Office to continue to deliver the work for multiple disadvantages, in line with Bristol's multiple disadvantage strategy. So that's point one, which is basically saying if this grant comes through from central government, that we will be happy for this scheme to go ahead. Point two, authorise the Executive Director, Adults and Communities, in consultation with Chair of Adult Social Care and Committee, and the Section 151 officer to take all steps required to submit bids and, if successful, accept and spend any grant funding, including procuring and awarding contracts which may be over the key decision threshold as highlighted in this report. And three, to note and support the Multiple Disadvantage Transformation Board as the City Strategy Forum for Multidisciplinary Oversight as outlined in this report. So, just like to move the report. Would like to move the report and its recommendation. Thank you very much. Thank you for seconding. And
it's a key decision, so we do need to vote.
oh, sorry, goodness me, I'm not on track. I'm not doing my thing today. It's a key decision, so I still need to ask the committee to vote. So everyone in favour? Yeah. Thank you. Fabulous. Thank you. Now you can leave after I've made a hash of that. Thank you very much. Okay, so we have... Yes. Thank you very much. So, oh, here he is. So, earlier, we had a public forum question, and the person who is Mr. Pearce had indicated he was attending. He turned up about 10-15 minutes ago. So I'm going to ask Mr. Pearce if he was satisfied with his answer and whether he had up to 2 follow-up questions. We're just going to bring the mic over to you. So if you...
Hello.
Hello.
No, well, sort of unsatisfied. I do have follow-up questions. my first question is, any chances you're going to like change these so they're a bit more kind of user friendly? Because at the moment I need to employ an accountant in order to work out whether I've been overcharged, because as I said, because you do it on a 4-week basis rather than per month, it's hard to tell whether I'm being charged for care which I didn't receive, because I don't know, because there's no way to really know from one month to the other next, because you're charging them for 4 weeks, and then it might be, so sometimes if you miss a week, obviously if it's properly charged, it would not be charged, because I would not, because it would, you know, it would be on the back, you know, it would just skip a week. But then sometimes I am charged when I'm like on holiday and I don't know this, because it's just been charged, and it will have to, I have to go, and because there is, it doesn't go per month, which would be much more helpful. Instead it goes like per, you know, so I have to like, sometimes it'll be like 6 months down the line where I was on holiday that week, why was I charged? And I just, you know, it would be much helpful if it was per week. I mean, also the invoice numbers, I know that's very helpful to you as the invoice for the council itself, but
keep your mic to your mouth, though. Keep your mic up here. Yeah.
Oh, sorry. What I meant.
Sorry.
Having like, is there a chance of having like a user invoice, or a user just telling you which sheet of what, you know, of number sheets that you are on, so that, you know, because for instance I've got a reminder that lets me know that I've got an invoice, which I've got an invoice number, but I don't know where the invoice is, and I don't know which invoice it is, because like I get like an invoice every month, and I find it frustrating because I can't put them in order properly. I mean, I don't know. I just.
No, that's okay. You've explained, and what I would suggest, and I'm going to, because what I don't want to do, and I'm not going to do, is put you on the spot, because you're kind of talking about things that's personal to you, if you see what I mean. So I think director of services here, we are going to make sure somebody gets in touch with you to go, because I'm going to say generally, just in general, to take any focus off yourself, we should, there are organisations that can support people with their kind of direct payments or their benefits and stuff like that. And I think it might be useful to revisit that for anybody. So can I suggest that that is the way forward, that somebody will make contact with you, and then actually what's really important is your feedback, so you can then give us feedback about the process.
My feedback is, could you add something to these invoices which have a clear identifier of which invoice in subsequent order that invoice is in,
yeah.
So that, you know, because so far it's just an invoice number, and that invoice number can vary drastically between lines.
Okay.
My second question, or my second thing is that it says the quote the invoice number when you make a kind of a direct payment for the banks. But since the invoice changes all the time, wouldn't it be better to have a single number which everyone could quote to, you know, to kind of allow it for easy transfer, rather than having a number that, you know,
changes?
Yes.
Okay. Yeah, like a personal identifier. Yeah, that makes sense. So our task for us is for someone to make contact with you, so that you know, I'm pretty much dyscalculus, so I get things complicated like that, and we'll make sure somebody makes contact with you. All right? Is that okay? Yeah. You're more than welcome. Thank you very much. Councillor, can I just clarify? Member of the public, you're not going to ask him a question, are you? Okay. Right. Let me just finish this bit. Thank you very much, sir, for coming as well.
I would just like to raise a point that he did raise another issue, which was about being charged when maybe he wasn't receiving the support. So I don't know if that's something that could be looked into.
Yeah, that's why I said that somebody will make contact with him so that he can discuss that in private.
Thank you.
Thank you. You're going to answer the question? You don't have to. Okay. I'm sort of like saying, "No, you're going to answer the question." Sorry, that's what I was saying. Hopefully not.
So I just wanted to say thank you for raising this. We want to make it as easy as possible for people to pay and to be confident in what it is, and remove a bit technical, well, not too technical, remove the friction that makes it hard for people to pay, because then more people will be more confident in paying. So I've been here about 18 months. This is the first time I've heard this direct feedback, but as soon as I saw what you'd sent, I was like, yeah. My team has looked, it's a separate team in the council. So one council, I'm not, passing responsibility elsewhere. It's a separate team, and we've actually already improved it to what you've seen now, but it's clear that there's a lot more that hopefully we can do. So thank you for raising it. We will be in touch, and it's really helpful because we want to get it as good as possible.
One more final point on the subject. Thanks.
Yeah, just again, I echo Tom's points. We know that we can do better with this. We've got a corporate programme underway around how we collect income and debt, and so we are working on it, but we would very much welcome your insight. So to repeat what other people have said, but we are aware of it, and we're going to make some changes.
Thank you very much. Okay, so let's move on to our next point. Just turn the page over. Okay, so we're moving on to agenda item number 10. So I'd lost my place just now, which is agenda item 8, adult social care provider sustainability updates. So I'm going to invite Tom Wilson to introduce and outline the report, which provides a strategic overview of market sustainability. Tom, over to you.
If I sit back, is it still picking up? Do I need to lean forward?
I'm deaf. You carry on.
I'll lean forward, it's fine. Good afternoon, everyone. So this paper is a sequel to a paper that I brought in March of last year. You won't have to wait so long for the next sequel, because I'll be back again in March this year. So this is about what happened after that paper. So that paper was proposing how we'd use the money that we'd set aside for inflation, and it warned of concerns and risks in the market because of the increasing cost of providing care that came about as a result of national insurance increases and real living wage increases. I think the headline is to say things went a lot better than I feared at the point that I said I would come back. So we have had about the same number of providers handing back care, only 2, as we have had in previous years. We've had a sustainability panel in place, and a number of providers came forward to that. We've managed to satisfactorily agree a way forward with all of them such that they've been able to continue during the year. Some we gave more money to, some we didn't give more money to. There was one particular area which is younger adults with learning disabilities, providers supporting them with the providers that particularly came forward to us. So that's something interesting for us looking forward into what to do. So, as I say, there's more detail in here. It's a 10-page report. I wasn't going to go through all the key bits. One thing I did want to draw your attention to is, and there's a table in there with average costs. So we have benchmarking information from a national thing called MSIF, Markets Sustainability Improvement Fund. And it shows that Bristol is still paying higher than average unit costs across almost all care types, which may be one of the reasons that the market has sustained more in the last year than we anticipated. So I think what that shows is that we are still effectively paying providers, even though we didn't give as much inflation as was requested last year. The caveat to that, though, is just because we're paying reasonably high prices compared to other local authorities doesn't mean that any local authority is paying enough. So I've met with providers recently and they acknowledged what I was saying about how the market has stood up this year and how we're thinking about inflation for next year. But they did say, yeah, at some point it's not going to be enough. So just because it's been enough this year for us to survive doesn't mean we've prospered. And equally, there may well come a point where we can't continue to deliver if you keep giving below inflation uplifts.
Right, thank you very much. I was paying 100% attention to that. Councillor Weston, do you have a question?
Yeah, thank you. Sorry, you mentioned you had 2 providers basically say no thank you and walk away. How many more came to the table? Well, I'm just wondering, is it each year are we getting less and less and less, or actually does the pot replenish, as it were?
Oh, so I thought you meant how many came asking for additional payments. How many new providers?
Yeah, because you said 2 handed back contract and said we can't do it.
Literally hundreds.
So there is buoyancy within the wider market.
Yes, so the
in number terms.
Yeah, so the adult social care single framework, which has been spoken about here, but I won't go into detail.
Rolls off the tongue.
The 3rd round of opening, we've just finished evaluating that now. We had 402 providers bid to enter the framework. So we've got lots and lots of providers in most areas. There's already 140 home care providers on the framework, and we had 1 package of care in December. We had 26 providers bidding to meet that 1 care need. So home care, supported accommodation, which are a bit more flexible, you can open them up more easily. Really thriving market, suggesting that we're paying enough for people to have viable businesses. The ones that are more difficult are the ones, obviously, where capital is a much bigger. So nursing homes, residential care homes, it's harder to change the market for them. And so they will be seeing their costs probably increasing and the amount we pay not increasing by the same amount. We have a monthly report. So the brokerage team is one of the teams within my operational commissioning area. And they do a monthly report on market sustainability and purchasing. Across all sectors of that, we've seen improvements this year with fewer people waiting for services, apart from one area, and that's day services for people with learning disabilities, which the number of people waiting has stayed about the same.
So, Councillor Gallison, you had a question? No. I've got a question, then Councillor Blake, you can answer next. Ask next. So, I just wanted you to reassure members as well as members of the community who may be listening that you're not saying that 500 providers are all currently have been assessed by us, and that all, number 500 on the list who's just come onto the framework wouldn't necessarily get anywhere near our service users because they're so far down the framework. So can you explain that a little bit? I mean, I'm not saying that is an absolute fact, but I think that we might get a question about this, so it's probably good to answer the question before it actually happens. Just explain how people bid on the framework, etc. If that makes sense.
Yes, so it's another one where we talk about the adult social care market as if it's one thing, but actually it's a number of things. So some providers, we're really pleased because they are providers that were on our legacy frameworks or providers that we've got people placed with who hadn't joined the framework in earlier rounds. So local nursing homes, we really wanted them to join, so they've already got people supported by them. Now they're on a single framework, which was the intention from the start. Probably the key part is home care, where there are hundreds of organisations wanting to work with us. So already we have a ranking tool that determines who work is offered to. And already only really the top 10 are picking up regular work. So that's the top 10 out of 144 who have been on it over the last year. That number's about to swell. Now, it's entirely possible that one or two of the new providers come into the top 10, and therefore those providers may well pick up work, pushing down some others who will be getting less work. We have a plan. I'm not ready for this policy committee yet to share what the plan is. We're looking at the home care market and what we can do to have a different distribution of work. But so yes, we're not suddenly going to have hundreds of providers picking up care that haven't been currently. We might have some successful, as I say, home care providers or some other successful providers picking up work. In that case, we do have the quality team who will go out and see them early on. So we won't just suddenly have loads of work with people that are new that we don't know.
Thank you very much for clarifying that. So, Councillor Blake and then Councillor Y.
Thank you, Chair. I think it's really important that, and we've been asking for this for some time, that we bring back how we rank these providers in all domains. I think just for the sake of transparency, for the sake of the public understanding how we do that, it's vital. And I think every month that goes by without us seeing it, I think is another month missed. So I think I'd really encourage the officers to bring it forward as soon as they possibly can. And I know that there may be some work to be done on some, but I think it'd be great to have a report that gives a pretty comprehensive view about how we rank people on the single framework. First question. Second question is its framework's a really good way of the predetermining a number of factors of the quality of the provider, and very supportive of our approach with the frameworks and good work you've done on that to get lots of providers on the framework. I guess my question would be about that is how many of those providers are coming in with good CQC scores? And is it's one of the gates to get on the framework? You've got to be good or above. I know you can lose that status once you're providing, and we give support, I think, for people that requires improvement. But yeah, so what's the sort of gateway around CQC and making sure we get good providers? And I think that was it. I thought I had one more, but I've forgotten that. I may come back to it.
You can always come back to it.
Firstly, apologies. I wasn't aware that there was an outstanding wish for the committee to see the way that providers are evaluated. We can do that. So again, because services are different, it's different. So in home care, there is a quality question, there is a price question, and there's a social value element. The social value is for 20%, the price is 40%, and the quality is 40%. But to answer your second question at the same time as answering your first one, no, CQC rankings are not factored in to the framework. It wasn't designed in that way. As we do call-offs, so as we change arrangements, so we use the framework is like a big group of providers that have passed a number of checks to be on our system, working the way we want, agreeing to deliver to our specifications and our rates. As we do call-offs from sort of when we did, for example, the prison home care service, then we take much more of an account of quality, specific quality at that point. So that is one of the things we're looking at, and that's certainly one of the things we're looking at in relation to home care. With other services, a lot more. So if, for example, you're in nursing, we don't say the number one ranked nursing provider is where you go, because it might be completely different size of the city to where you live. So personal choice comes into that a lot more, as does location. So it's not black and white how it works, but we can definitely share the evaluation mechanisms.
And I also want to just stress that there is a lot of work being done to address the single framework, which was before our time, as in it came into being in September 24, but I think it had May 24, but it had, it had already started its embryonic journey long before that, and we are looking at it. That's really important. Councillor White.
Sorry if this is going to be a bit rambling and not a very precise question, but
please answer a precise question.
I mean, firstly, I just think your team have been really good in actually. I mean, I had a provider of day services in my ward who was struggling, and actually, you did a really good job in looking at their and actually increased the rates on them. So that kind of reactive response is really welcome. I just coming from the chair of a care home perspective. I mean, we're a charity. We don't make a profit. This year, we're looking at an increase at double the rate of inflation for a number of factors. Partly also the acuity of all our residents has gone up as well, so it's not just sort of standard inflation. And speaking to a lot of other people, that's not unusual. And some of them I spoke to provider the other day, and they're cutting costs, which I think maybe is the risk that we need to think about this. So they were a real living wage employer, and now they've ditched that because they can't afford to do it. So I mean, it's great that we didn't have a real hit this year, but I think the pressure really does feel, from a provider point of view, it does feel quite there. And I don't really get a sense from I think the paper is really helpful and really good, but I don't get a sense of kind of how at risk we are with some of these. And I accept for home care is reasonably low risk in the context, but where are the other big risks that you're looking at, and how. How big is that? Sorry, rambling, I said. Don't feel you have to answer everything, because some of it's just me rambling.
So what would be your key points?
My key points was, this is not gone away, even though it was good last year, and actually how much have we looked at the other risks, like providers trying to cut costs, right, and where are the most scary risks for you this year, Tom, I guess, in the market?
Are you able to answer that question, Mr. Wilson, or would you like to send a written answer?
I can talk about this stuff all day.
Okay, but yeah,
trying to do it concisely.
Yes, please.
So I cover it in the report, which was that last March I created a corporate risk on the corporate risk register, and I scored it 3.7, I think, 21, which is just about the highest risk you get, which is a very high chance of a more than £5 million impact, because we'd looked at it and said, actually, we think we probably need an extra £8 million over and above what we passed on, because the feedback from nationally and locally and working with our partners, Care and Support West and local providers, was this is going to be catastrophic. So, high risk. By the first time we revised it, we were able to put it down, because we were able to see that actually those things hadn't happened. So I don't feel currently, and I might regret this, and providers watching back at some point might say, oh, hang on a minute. I don't feel currently that I think in the financial year coming, we're going to get that flood. Now, we might get an uptick, so we may well get 6, 8, 10 handbacks rather than 2, but I'm not expecting it to be 50 handbacks. However, not going out of business or not handing back care isn't a particularly aspirational bar. So that's not me saying everything's okay. What I'm saying is, this time last year I was really worried, and I'm less worried about sustainability. And I think that is because providers will want to continue to provide. That's what they do. They do it for all sorts of reasons, really good reasons, because that's what they care about and that's what they want to do. But they're not going to want to go out of business, and we still pay more than most other places, so we're not going to be the people they pull back from first. So what am I worried about? I think, just as you say, I think quality. I think we're asking people, just like the council's got a very tough budgeting round every year, providers have very tough budgeting rounds, and you're describing the experience in one organisation. I think what we won't know, and however good we are, however good our quality team is, we won't know some of the decisions that are being made within providers to be able to remain financially viable. And we need to be as good as we can be through our practitioners, picking up on things, through complaints, through concerns, through safeguarding, through third-party feedback on spotting when we think something isn't working and going in. So our intelligence needs to be really good. But yeah, I think if I've got a concern, it would be around quality dipping and that impacting individuals before we understand it and are able to react.
Councillor Gallistone and then Councillor Blake.
I'm sorry, I didn't realise, but I have to declare an interest. My support worker, Ben Grimes, is part of Shared Lives.
Thank you, Ben. Councillor Blake, last question, I think.
Yeah, I remembered actually what I've forgotten now, and it was about the sustainability issue. And following on from what Tim said, I think there might be a tipping point with this. So you might not be finding providers handing back contracts now, particularly, so they'll be handling this issue as we go until there'll be a point where they'll fall over, quite a number of them. Now, I know that there's tension in the system right now. There's industrial action going on over pay because providers have not been given the inflationary uplifts and therefore have been kind of pressured to put pay, at a point where it hasn't kept up with inflation, and there's a lot of tension there. I know that there's providers that have done what Tim said, have ditched their commitment to the real living wage and just gone with the national living wage. Now the two things are getting closer together now, those 2 points, but nevertheless, one's higher than the other, and that's going to impact on quite lowly paid staff. Now, obviously this roots back to the government, because ultimately we're funded by the government. Government funded us 8% last year, 8-point-something% last year. They're funding us over 6% the next 3 years. I just want to make sure that the adult social care gets its fair share in this council. And also, given that we are the biggest spending department, I would also argue that we ought to make a case for some of these vulnerable clients that we deal with in this council. So even though our benchmarking might talk about us paying more, I think there's a whole raft of small inputs that go into that through Bristol being an expensive city and the rest of it. We can get into the arguments around that. But I do think it's quite fundamental. This is a sort of council discussion, really, about the adult social care budget and making sure that we actually can service the needs of the individuals that we serve, pretty vulnerable individuals that we serve.
I mean, I'm not going to expect Tom to answer that because this is what we're doing. This is the conversations. This is all the work that goes on behind the scenes about the budget. And I know that Tom's got a response about the percentage and so on. That was, the national government paid us to be able to. It was way below what would have been needed to give every single person, care agency an uplift to what the living wage would be. So I think it's a very complicated question, and I think that it would be good for Tom to formulate a response which is measured, and we can always bring it back here. The budget is coming forward now. And I'm also sure that we could spend the next sort of 10 minutes talking about that element of the budget that relates to 25 to 26. But I think it's probably not the right time to start digging into the budget unless Tom wants to put himself in that position that he wants to answer that really complicated question.
I was just going to agree with you to say that we are coming back in March with the 26-27 inflation uplift, so maybe that's a good time for that conversation.
Perfect. Excellent. Any more questions on this area? Right, I think we've had a nice, robust discussion on that. So note that this is an update on... Sorry, just ask the committee to note the recommendations, right, which is that the policy committee note the update on market sustainability as a follow-up action to the paper considered in March 25. Sorry, everybody. And I've got my wrong glasses on as well, so it's not helpful me not seeing what I'm looking at. So we're just noting this, okay? Thank you. Okay, so I'm going to change my glasses so I can actually see what I'm doing, because that would be really helpful. And we're going to move on to a 5-minute break. There we go. Thank you very much. Good timing. So let's move swiftly on to agenda item 9, which is Period 8 Finance Outrun Report 25-26. So this is the Period 8 report on financial performance against the 25-26 budget. The full Period 8 Finance Outrun Report 25-26 was presented to the Strategy and Resource Policy Committee on the 20th of January this year. So this paper contains the appendices relevant to adult social care. There's no decisions to be made as this report is for information, and I'd like to invite Hugh Evans to introduce and outline the reports, and then at the end, obviously, members, you have the opportunity to ask any questions.
Right, thanks for that, Councillor Chair. Councillor Chair. That's good, get the protocols right. Okay, so I think probably the report is available to you for your reference, and it has been since the Strategy and Resources Committee when it was initially wheeled out. I think probably Appendix A3, the specific appendix pertaining to this committee, is probably the most useful and contains the most detailed information that you'll be interested in. I think probably the first thing to note, the highest level headline, is that at Period 8, which was in November, we were projecting adult social care, which is Meta's Adult Social Care Operations Division and Tom's commissioning division. We were projecting an overspend of 5.3 million in aggregate. That's from an overall budget of just over 200 million, which reflects a 2.5% projected overspend. I'm happy to relate that in Period 9, which has recently closed, that overspend projection has reduced by about £1 million. So we're now projecting a overspend of around 4 million on the year, and there's quite a lot of detail that underpins those, but I think it's necessary to note that we have got quite a stable budget position now, and it has been for a number of months, even though at the beginning of this financial year from April onwards it was quite volatile. From about July, August time, with the work that we've done between us, we've managed to stabilise our budget position, but there are some ongoing issues that will require additional work for us in order to address them and to bring the budget into line as much as we can this financial year and then into the next financial year. There's one or two issues that I'd like to highlight from the tables. I think probably from Table 2, the Adult Social Care Revenue Forecast Variances. This is in Appendix 3. We're on page 208 of the pack. You'll see that we do project spend quite significant additional variance in our purchasing for people with physical support needs. So quite a lot of older people, the needs that older people that present with kind of issues of older age and frailty tend to be in that bracket. You can see that we project a variance of around 5 million in regard to learning disability, and I think that tells a number of stories. Not going to speculate on them too much here, but not only are people living longer, which is a good thing, but they're living longer with much more complex conditions, so that necessitates quite high levels of spend. But it also, I think, reflects some issues in the markets around how care is provided for people of working age with learning disabilities and mental ill health, to be fair. and some of the issues that we see extrapolated much more broadly in children's services you see here, about how markets tend to, the price of cost of care has increased quite significantly. So that's the work that Tom and commissioners are doing in order to address unit costs and to ensure that we pay a fair cost for the care that we buy. So you can see how in those three areas of our purchasing budget, physical support, learning disability and mental health, you can see increases. You can also see, although, as I say, there have been slight decreases from period 5 in the purchasing budget, but overspends nonetheless. So it's, it shows that the work we're doing to try and mitigate spend is working, but it isn't working sufficiently to bring our purchasing budget spend totally into line. You'll also see some additional some overspend, nearly 600,000 on memory and cognition. That area is about people with dementia, quite often older people, primarily older people with dementia, but I think we and adult social services departments up and down the country predict quite significant increases in that in upcoming years. The next point that I'd want to make in regard to our patterns of spend reflect the evidence in Table 3. You can see how the difference between period 5 and period 8 show increases, albeit, it's a lot of money. £273,000 for nursing care, for example, is a lot of money, and £116,000 for residential care. But in context of our overall budget, it's quite small increases, but increases nonetheless in our projected overspend in residential and nursing care, which again, there's a lot of analysis we could do in regard to that, but quite significant pressure in the urgent and emergency care system does deliver to us more people in need of bedded care, but at the same time we're always acutely aware that we need to find alternatives in communities and get people home as much as possible, as quickly as we can as well. What's quite good in this table is that you'll see, especially in the context of supported accommodation, an area that was overspending by quite significant increases month on month in the first 3 or 4 months of this financial year. You'll see supported accommodation spend reducing, albeit by only around 200,000. We've seen further reductions in that, reductions in that in period 9. That's people with multiple disadvantage, like we were talking about earlier on, homelessness. Just draw your attention to homelessness and, quite often people who have come out of mental health hospital and prison releases and things like that. So we're working very hard to ensure that we get a good bargain when it comes to the delivery of care and support services for those people. The report also shows quite significant improvements in income. We still are projecting more income this year than we were than we initially thought we'd get, which I think is very positive. It's worth, I think, finally, very briefly, let me just get it so that I can see that again, noting the issue around bad debt provision. Now, we have, as part of the corporate programme to deal with income and debt, as I mentioned earlier in response to the gentleman's question, we are doing some quite in-depth work corporately around the debt that the council carries, debt that money that people owe the council, and we have been doing a lot of work in adult social care to redress that debt. Now, the bad debt provision that you see in, I think it is still Table 3, shows about 2 million, just over £2 million that we are contributing from our purchasing budget for aged debt that's over 180 days old. Now, it's necessary and right that we do that because the council doesn't want to be carrying huge amounts of debt all the time. It's necessary that we redress that. But at the same time, when this budget was set, us taking on bad debt provision in the budget wasn't factored in. And if it wasn't for that, and this is a point that I'll cling to until the end of my days, if it wasn't for that, in period 9, we'd be projecting about a 2 million overspend instead of 4, because that 2 million wouldn't be there. And that would be a 1% overspend, and that's getting on to being pretty good, really. So I think what this work does show is that the effort that we're putting in to address our prior overspends is working. It's taking a little bit of time, but I always said that our adult social care transformation work was a 5 to 7 year programme. We're at the end of year 4, and I think we're making a real difference with all of this. So I think it's essentially a positive story, better in period 9 than period 8. It would have been nice if this was a period 9 report, but we're on the right, in the right direction, good trajectory, I think.
Okay, thank you, Hugh. So we've got a question from the floor from Councillor Calistone.
So, 2 things. Just to confirm that the red means money in or income, and black is money out, and that's expenses.
Well, it depends on which line.
Table 1?
In which I mean, if you look at like the adult social care in table 3, residential care, nursing care, home care, extra care, housing, when you look at the variances, the black ones are an increased overspend, and the ones in brackets in red are a decreased overspend. Okay. But if you look at the expenditure and income lines, you'll see that it's the other way around, because obviously income is opposite of expenditure, isn't it? So it's a bit complicated, and I can't pretend that on every single line I can give you proper chapter and verse, but I like the bottom line. The bottom line's quite straightforward, and that gives you a pretty clear picture.
Thank you, Hugh. And my actual question was, is there anything that can be done to reduce the overspend, and what is it, and hopefully without cutting services?
I'll jump in, but colleagues will jump in as well, because it's only fair for them to have a go. But we're doing a lot, as I think we've explained in many prior committees. We're doing a lot to reduce overspend, and I think there's evidence to suggest that we are doing it. We exactly don't want to do what you're talking about, which is to chop a leg off. That will save you 10 million quid. We can't do that. That would make our entire services much less effective. But we're doing work that will deliver us gradual but sustainable reductions. I don't know whether colleagues want to come in.
Yeah, so the amount of money we spend is a factor of how many people we're supporting, how much support each person gets, and how much we pay. So in each of those 3 things, there are more things we can do, and some of them are brilliant, win-win things, and some of them are necessary things that we just need to do because we've got to manage, the council's got a legal duty to set a balanced budget. So how many people we support, we're looking at how can we support people as effectively as possible to get help from the voluntary sector, maybe technology. So what proportion of people that come to us is there no option other than them needing an ongoing social care package? So that's all work, and these are things that we're doing, have been doing, and will be doing more of, all of these. So I won't be specific, I would be here all day. How much care do people need? So we've got a reablement service, which is about supporting people mainly out of hospital, but doesn't always need to be out of hospital, enabling them with OT and physio so that they don't need as much care ongoing. The more effective that is. We've got services called Help When You Need It, which is outside the council, outside of eligibility for social care. So it's about preventative, helping people be more independent so they can do. So, for example, someone can learn to cook for themselves with that support, or someone is helped to access befriending services so that they don't rely on care services. So that there are ways that you can provide support so people need less. Obviously, there are also ways of giving people less. So not 5 days at a day service, but 1 day at a day service is less. But that is a reduction in the amount of service. normally in that respect. And then how much do we pay? The last report was a good example of that. So there are still some areas where we think that we are probably paying more than we need to because we're paying more than other local authorities. But of course, restraint in that area means that providers will be getting less and make up corners, etc. So those are the three areas that we look at, and in any of them you can think about things that we can do. So yes, there is more we can do. I think we've built a really strong foundation in the last couple of years to be able to do more of those really more innovative, creative and value-adding things, having done quite a lot of spend control to get to this position.
Meta, were you going to jump in or not? No? Hugh, and then Councillor White and then Councillor Blake.
Couple more just points to add. Thanks to that. Tom's 3 boxes, I call those, which is how many people, how much per person, and how much do we pay for it. So that's a good aid memoir. Just think of Tom and think of his 3 boxes. You can see the work that we're doing in Table 8 in regard to the delivery progress against our savings as requested by Councillor Weston, and so that is now going to be a regular feature of these reports. What I'd like to also highlight, and this is something that is really quite gratifying, and I think we've all got, you know, corporately we've got a lot of positive kind of progress to show when it comes to data. Our awareness, our understanding of these things is vastly better. The tables that you see after the, you know, all the Power BI stuff that you see after highlights just a little dip in of the data that we have available to us, and we use that, as Tom described, to compare our activity against all sorts of other comparator councils across the country, core cities. There are comparator groups in the SIPFA, which is the finance organisation by their reckoning, and in the southwest. And so we do compare ourselves all the time to other councils and look at how we're performing. So that helps us to judge what the best areas of activity are.
Thank you.
Okay, so Councillor White, followed by Councillor Blake.
Yeah, a quick thank you and then 2 questions. So if you remember a couple of meetings ago, Mark and myself raised some issues around this, and Tom and Lorraine and yourself, you met with us to go through some of the things, and so obviously Mark's thing is in the report. He couldn't make the meeting, and some of the things I was concerned about, like seasonality, because last time we were on month 6, Tom was able to convince me that wasn't such an issue, and I think that's borne out by the figures. So, I mean, that was just really helpful, just to kind of have a bit of a deeper dive into some of that. So that's my thank you. 2 just quick questions though. First is extra care housing going down, that was our solution for placing too many people in residential care. So I'd like to understand a bit, is that just people getting less hours, or in which case are they refusing to take people with higher level needs? There's something going on there which I'd just like to explore. It doesn't have to be now particularly. And I guess the other one is, you know, one of our savings targets around sort of fair settlement around joint funding like 117 and CHC with the NHS. And that, I don't know, that doesn't, it's a tangential question that, but it's quite an important thing to pick up where we're going financially that doesn't obviously come through this. So that was my couple of questions.
Yes, just for the second of the 2, I think we're doing quite well when it comes to what you're talking about, section 117 and CHC. Yes, some of Tom's and Meta's colleagues have been working really quite doggedly at our joint work with AWP and the ICB when it comes to shared funding. Overall, as I mentioned earlier, the rate of expenditure on people who are subject to Section 117 aftercare, for example, quite often people who've had, well, always people who've had some form of mental health hospital stay, has increased massively in the last 3 years. So all the gains we've made have been overwhelmed by additional demand. But that said, we are now in a better position when it comes to our conversations with colleagues in the NHS in order to get fair shares. and you see that reflected in some of the income numbers that we've got in the budget. So that's a positive story for this year. In regard to extra care, I don't think we should necessarily, I mean, Tom will maybe want to comment, but I don't think we should get into a long conversation because that's a very complicated issue and there's a lot of work to do there. But I rest assured that Tom is on top of it. Do you want to say anything about it?
Yeah, just to say we're doing a lot of work on extra care. Reviewing the model and making sure that it does what we want it to do. So you're absolutely right. What we would like extra care to do is support people who would otherwise be in residential care. We need to have the model right to do that, because if you don't have the right staffing basis to start with, then you're not confident that you can meet the needs of people with higher needs. So we're in that mix at the moment of trying to ensure that we get the service design right so that we can support the right people in extra care without investing lots of extra money to support the same people we're currently supporting, which isn't reducing demand for extra care. So it's a complex one. We are working with the sector. We had a co-production workshop 2 weeks ago. And it is a priority. It's not gone as quickly as I'd like, but it's a priority.
Councillor Blake.
Thank you. I had two uncomplicated questions, you'll be pleased to know, Lorraine. First one was asked by Tim, actually, about the NHS funding. So that's now down to one. Mine's about bad debt, actually, and about service users. To get themselves into a position where they're struggling to pay. And it says in the report that active recovery actions continue. Now, I wondered what that really means, because these individuals obviously are receiving some level of support. So I would imagine that they could be vulnerable individuals, and therefore, how are we ensuring that we take that into account when we're dealing with this bad debt?
I'll just start by saying very carefully and case by case. But that said, we do need to be sharper about how we retrieve debt. But most importantly, and then Tom will obviously come on to this, is we want to make it easier for people to pay in the first place. And we want to make it easier for people to understand what they've got to pay in reference to the gentleman's question. And we've got to ensure that, we use online direct debits and other opportunities to make sure that people don't get into debt in the first place. That's got to be the primary goal. But
yeah, there are no punitive debt collection measures within adult social care in Bristol. So we are proactively following up with people, phone calls. There's some key things. I mean, most of it is preventing debt in the first place. So, for example, getting as many people as possible onto direct debits, which when someone said that to me, I said, well, how else are people paying? And I think we've heard a bit today about the friction around paying. So making it easier for people to pay is absolutely up there. We are looking at how we can increase our debt collection rates, but those things will all be, involved members, and we absolutely recognise that we are a service that's here to support vulnerable people, and we need to remember that is our ethos.
Thank you.
Oh, sorry, Meta. Sorry.
No, I was just going to very briefly add, as Tom and Hugh have mentioned, the best thing to do is to make sure that people don't get into debt in the first place. And one of the things that we're making greater efforts is to make sure that we talk to people about the contributions that they might need to make right from the start, before we've even completed our assessments, that we have an honest conversation about the fact that those are the rules and you will be sensitively assessed in terms of your ability to pay, so that people don't have any surprises later on and find themselves caught out by that. So we need to make sure that we have those conversations, and I think it's important for all of us to understand that we just need to be really grown up in our conversations with individuals and families about that at the earliest stage.
Yeah, excellent, because I was going to say that actually, so well done, Meta, because it's something that was brought to the service's attention and action is being taken to deal with it. So it's a case of you said, we did, and that's really important, that we are being responsive to concerns raised by members, drawing down on services. So just to conclude this item then, I'm just asking committee to note the report because there's no decision to be made. Okay, thank you. Okay, so let's move on to agenda item number 10, which is the quarterly performance report, quarter 2, 25 to 26. I'm going to ask Meta and Tom, to actually go, take you through this, and I'd just like to ask as well if Meta and Tom can tell us what month we are talking about, please, so that members are clear. Thanks.
Thank you. So I'm pleased to introduce this report to you, which is for information. So we're talking about Q2, and what we mean by that is that that's the end of the second quarter, which means September. So there's quite a time lag in between the data and the information that you have in front of you. So just by way of introduction, the report sets out the Council's performance framework, and there are lots of links there for members to be able to follow through and look at the detail should you wish. There's also commentary in the report where performance exceeds target and also shows where performance is not yet at the desired levels. And I think I have to admit that the Council's performance framework is quite complex. So our job is to try and make that more straightforward for you. And you may want to just refer to the appendix, which actually sets out the specific metrics that relate to adult social care. But they capture both business plan actions, performance metrics, and also city outcomes where they exist. It's worth just highlighting to you that on the appendix, which is where you'll find the detail, I think that's page 224 in your pack, the way that the data is set out, you'll see the coloured columns in the middle. They refer to, the first column is the Q1, so the June performance. The second coloured column is Q2, and then you've got an arrow. The arrow doesn't relate to the coloured bars in the middle. They relate to the direction of travel compared to 12 months ago, i.e. a whole year ago from now. Can be a little bit confusing to read, so I wanted to point that out to you. And if I was to give you a couple of examples, and then I'll hand it over to you for questions. So, for instance, in the second block, where it relates to reducing the average wait time for initial Care Act assessment, you'll see that the target for this year is 42 days, and that at the end of Q2 we were on 52 days, and that therefore gives us a red RAG rating both in Q1 and in Q2. But you will also see an upwards arrow, which means that the trajectory is in the positive direction compared to 12 months ago. So that's what I'm wanting to explain. And you'll see one below, which is around increasing independence for people enabled to live at home. And you'll see that it's got 2 positive RAG ratings followed by an upwards arrow, which means that we're both meeting the target this year and it's an improvement on 12 months ago. So that's kind of how to read the report, and I thought I wanted to share that with you. The main Word report sets out examples of where performance exceeds and is behind schedule, but I'll hand it back to you for questions.
Are you going to add anything, Tom? Or
I was thinking I would answer questions that come my way.
So let me just change my glasses, and I think we've got Councillor Clark and Councillor Callistone and Councillor Durston. Right. Was it right, Councillor Clark? Did you say? No. Oh, sorry. Hewitt thought it was. Sorry, I'm saying Councillor Clark because I thought Hewitt indicated it was you.
Sorry, that was my mistake.
Oh, sorry.
My mistake.
Right. So, yeah, Councillor Callistone.
Hi. So, I just wanted to confirm. With PB 101, is that steady? Is no change? It's the bottom of that table.
Yes. So it was 5 days. It's still 5 days. So there's no direction of travel.
Okay.
I think.
Thank you.
Excuse me. Did you answer? Is that okay? Fabulous. Councillor Diston.
Thank you, and thanks for explaining the way the table works. That's really clear now. So I haven't quite had time to scroll down to this bit in there, so I could probably answer my own question. But one of the areas for improvement that's mentioned is the work with housing delivery partners to increase the supply and improve the quality of supported living schemes for adults, which is currently behind schedule. I was just wondering what the reasons are and how we're hoping to mitigate that. Thanks.
So the reasons are that we underestimated how hard it would be to get them built. However, the good news is all of the schemes are now they're not all being built, they're all progressing towards being built. So we had a number of proposed schemes in the pipeline. We've now got all of those through all stages of governance within the council to confirm we absolutely want them to happen. And some of them are, well, they're at different stages, but we expect the first ones of them to be ready during 26-27 rather than 25-26. So the work is still brilliant. It's still going to achieve the benefit. There's a pipeline that's still getting bigger, but it took longer to get through our governance because actually we're talking about investing tens of millions of pounds in support costs as well as working with providers who will be getting the rent through housing benefit for people going into those schemes. So it's happening. It's groundbreaking. We're way ahead. Hugh was talking at national conference, not probably more than one, about where we're at, other people wanting to learn from us, but capital, I mean, I think we know this, right? But we were naive when we started putting in the expected dates when they'd be ready. Capital takes longer to do than we think.
Thank you. And so are these schemes where we've kind of used council-owned assets and we're using those to kind of turn them in with housing into supported living?
Yes, there's a mix. Some are, the majority are council because there's a really good arrangement whereby we get to look at assets that the council no longer wishes because obviously it's a win-win-win. We still get the money for the asset and we get to be supporting people with the most complex needs in the city, sometimes bringing back from further away. And then there's a revenue saving as well because of the way we do it is less than the market that Hugh was talking about in the finance bit. Because the building is here and we're providing the support, no one can leverage us with the scarcity costs. So yeah, that wasn't what you asked me. You asked me if it is those buildings. Yes, it is, but there's also some other sites.
And I guess just to add to that, adult social care, children's services and housing, we're going to be having a joint briefing within each of our areas to discuss the whole area of housing. So we are very, very involved in the understanding around the housing and different elements that are coming forward, which will then eventually present itself to committee. Councillor Weston?
Thank you, Chair. Sorry, I'll get near the microphone. I just got a question on ASC003 about the YATS transition, if that's okay. Now, this might be one of those where, again, this sort of crosses from children and young people services into us. It is, after all, a transition on it. And we seem to be, I'm sure there's a huge amount of work into it, moving in the wrong direction on it. I just wondered what the barrier was. Is it the services being overwhelmed? Is it complex issues? And equally, YATS itself covers a whole range of things. So, you know, it could be, I've got my list here. So when we're dealing with transition, that can be people with learning disabilities, impairments, young people leaving care, etc. Is there a specific sort of cohort within the YATS service that's we're spiking on? I just want to know a little bit more about that.
Yes, please, Meta. I was just getting back to the right page. Carry on. Sorry.
Thank you. Thank you for that question. Good question. So we're really committed to making sure that young people and families have a positive transition and that we work with people across the pathway in good time. And there are, as you say, some challenges that's making that harder for us than it might be. And we're not at the place where we need to be. Mm-hmm. There are two particular spiky issues, to use your own phrase. One is definitely a staffing capacity issue, which the YATS team has struggled with, not because there's any specific reason for it, but just turn of events. So that's been challenging for us. The second, which I think is emerging as a more complex issue, you'll be aware that we had a transitions project last year, and so our pathways and our information sharing and the way that we do that are really quite well settled. And it works, I would say, reasonably well for young people with disabilities who are known to the Disabled Children's Team, and where there's lots of opportunity to predict and to plan ahead. Where I think it works less well is for young people in more complex situations who might come through care, who it isn't really understood until much closer to their 18th birthday that they might not be able to manage with the support that they've had through the children's service. And adult social care then gets involved at a fairly late stage sometimes, when the kind of multidisciplinary team around the young person works out that actually they will need care into adulthood in order to be able to manage. And that transition is not as smooth, and we sometimes are notified much later about those young people, but also the kind of service offer that we have for those young people is not as straightforward, because we're talking about people with multiple traumas, for instance. And so that's a kind of a new area of discovery for us in terms of how we best support those young people. So those, I would say, are some of the reasons.
So, for I mean, on young people leaving care, so I imagine if they're in our care, then we know them in advance. So they actually probably are getting a good service from YATS. This isn't me trying to go for a gotcha moment, by the way. This is me just trying to understand on it. So, but you're saying it's the late arrivals, as it were. That's where the tripping hazard is.
Yes, the late arrivals into the adults, young adults transition service. But it's also those young people where I think there would have been an aspiration that with all the support that they've had through children's services, that the expectation is that they would be able to manage. Yeah. And a fairly late realisation that actually, for reasons that you might not discover until somebody's in teenagehood, how they respond to some of the trauma that they've experienced, that we discover that as a system that longer term support is needed.
How large is the YATS team, out of curiosity? Could you email me? Okay. Thank you. Thank you, Chair.
Councillor Blake?
I had a bit of casework in my ward actually about this specific issue, and it was a provider providing support for a young person coming up to 18, and I pointed out that I put out to the provider that, as you know, it contacted adult social care a lot earlier. They did exactly what you said, Meta. So I think the issue probably we need to redouble our efforts in communicating out to our providers about the service and making sure they're aware of needing to come earlier. It was an atrocious process as well, and I think we caught up with it, but I could generally say I think it was the council did the best to pick it up. It was the provider that really dropped the ball on that. My question is more about Care Act assessments. So well done for it coming down. It's a stubborn figure to get down. But we know that obviously with Care Act assessments, it's so important to kind of support an individual moving forward in a sort of a stable way. So I just wondered kind of how are we going to get this figure down? And the second thing is that obviously when we get the character assessments put in place, there's sort of lots of follow-on activity often, and making sure that the follow-on activity comes in a sort of timely fashion as well. So I just wondered if you could say a couple of words on that as well. Thank you.
So yes, you're absolutely right. It is really stubborn, and the only way we can get there is to keep tracking our data and keep chipping away at it, basically. If I was sitting here delivering you the Q3 report, which is the December report, the metric will have gone down to 49. And so we are making progress. There is a vast amount less people waiting for care, but if you're that person waiting, it doesn't really matter how many people have waited. It only matters how long you've been waiting and what's happening to you while you're waiting. So we have reached 49, which is not where we need to be, but it is showing, hence the explanation of the arrow, hence the arrow going up, because compared to 12 months ago, that's a very different position. Our aspiration, our eventual target, is 28 days. Right, that's where we want to be, which is the equivalent of really people not waiting any substantial amount of time at all. And even 42 days or 49 days, as we are at the moment, means that there are some people who've waited a lot less than that, and some people who've waited for longer. And it's probably worth sharing, although Councillor Blake, it wasn't actually what you were asking, but I thought it's important to share with you that we do have what we call a waiting well framework. So we make sure that we are in contact with people while they're waiting, and we have opportunities to review the risks, and we prioritise in accordance with risk. So if somebody needs help now, they get help now. They're not put on a waiting list, as it were. So we keep working away at it. And you're right, there are various stages after the assessments, including the search through brokerage, which is in Tom's service, and how long it takes to put the service in place, and so on and so forth. And we're able to track those things differently. They're not part of the public metric that we share with you here. I think the important one, though, is this one here, which is why we've selected it, because that's the thing that really affects citizens.
Thank you.
Okay, Councillor Martin.
Thank you, Chair. I'm looking at the row which is about reducing the percentage of contacts to adult social care for people aged between 18 and 64, starting services. And I'm aware that age range, there has been a big increase in the need for adult social care, or the numbers of those people. And I understand the objective there. I'm wondering if there are any potential risks there whereby that you can see where some of those people are being kind of pointed towards other kinds of services when actually adult social care is what they need, or if that makes sense, if you could maybe speak more about that project.
So it's interesting when you look at it, isn't it, that actually we've got a green rag rating, but the arrow is pointing downwards, and so our direction of travel from last year is lower. So there's a whole load of stuff going on there, including the volume of contacts that we have, which is continuing to increase. So this goes straight to what we call strengths-based practice, which is always one of those phrases that you wonder what it really means. And what it really means is that we're trying to support people to make sure that they get help in the communities where that's available to them, and that we talk to people about their strengths and their assets before we talk about providing care. So we want to make sure that people are as independent and have as much control over their lives as possible. And so that effort has to be about diverting as many people away from adult social care who don't need us, because they can get their support in their community from family, friends or voluntary organisations or whatever it might be. But you're also right that it's a really important judgment to make, because what we don't want is to turn people away and then they only come back to our front door because we made the wrong judgment. So it's a really careful judgment that needs to be made at that point. And we call those support conversations. So we don't just receive information and make a judgment. We have a support conversation with people, which is the thing that comes before the assessment, to try and really understand what's going on, to try and understand whether they have insight into their own needs, and are able to make decisions about their own care and support. And we might also at that stage have that conversation about charging, which some people might not be aware of, and people might then select to go and do their own thing. Whereas had we not had that conversation and we'd done the assessment and got right there to the point where we wanted to charge, and they went, oh, actually, I'll make my own arrangements. So there's all sorts of things that we can do in that support conversation to make sure that we have a really good understanding of people's situations, and their ability to make arrangements for themselves, and to make sure that the people that we do pass forward for a Care Act assessment are those people who really need us.
Did you have a follow-up? Mm-hmm. Go on.
So, and how long have we been focusing on that then, that kind of trying to reduce that age range in adult social care?
So I'd say we'd probably been trying to do it for a really long time, but I would also say that in the context of our target operating model that we've talked to you about before, that structural change happened in September this year. And so from September, we're able to demonstrate improvement in the performance that you're seeing here. Because we've concentrated our resources around what we might call the front door. So we've standardised and brought together all of the teams that support people at the very first contact point.
Thank you. Thank you, Joe.
Yes, and I know Meta meant September 25. You said this year. It's all right. It's yes. Well done. Councillor Calastoni.
So I think my question was just answered, but when was YATS first introduced?
Well, before I got here, so Hugh might be better answering that one. So the young adults transition, the young adults transition team was in situ before the target operating model, and it still exists now. So actually, that's one of the specialist service areas that hasn't been changed as a result of our pathways. It exists in the form that it was previously.
Doesn't turn on. Oh no, it does. Right, I can't actually. It was kind of 22-ish, and but it used to be preparing for adulthood, and then you had the other team, and so there were two teams that did a similar thing, and they were brought together, and the YATS kind of combined version with Through Care and what have you involved happened around. It was about 22. You came in about 23, didn't you? Yeah. So yeah, it was a short time before that.
Okay, last follow-up, maybe?
So, any kid who is statemented at school, are they automatically put through YATS when they leave? No.
You're showing your age.
No, it's the short answer. No. A young person or a child with a statement, there is a greater chance that they are not entitled to adult social care when they become 18 than that they are.
Okay, thank you.
Yeah, it's quite a complicated thing, isn't it? Anyway, let's not divert from what we're. We'll be here all day. Yeah. Okay, so is there any more questions? First of all, because we've had I think a nice robust set of questions and answers, and if anybody needs any follow-up questions, please do email in. This is for noting. I think I omitted to say that right at the very beginning, so just to say this is for noting, no decision needs to be made. Okay, so our last agenda item is our quarterly risk. Okay, quarter 3 2025 to 26. It said something else on this, don't worry. So quarterly risk performance reports. So this provides This paper provides an update on current significant strategic risk relevant to Adult Social Care Policy Committee to achieving the Council's objectives as set out in the Corporate Strategy 25 to 30, and summarises progress in managing the corporate risks, strategic risks, and actions being taken at Q3, 25 to 26. So there's no decisions again to be made. This is for information, and I'm going to invite Meta to introduce and outline the reports. Okay, and then as usual, the opportunity for questions on the end. Thank you, Meta.
Thank you. As Councillor Francis has said, this is the corporate risk report as it relates to adult social care. The important thing to point out here is this is Q3. So in the previous report we were talking about Q2. In this one, actually, we've been able to condense the time frame. So you're here looking at Q3. Which equates to December. So the risk register was last updated in December. So just a quick reminder and explainer, it is in the report that the adult social care has a service risk register, but the risks that we have got in this report here today are those that reach the level of what we call a corporate risk, which means that a risk score of over 20. And it means that you've only got 2 entries on that report. There are only 2 risks highlighted, and there is a third risk which is supporting one of the other 2 corporate risks, but that also scores 20. Those are around safeguarding, where there has been no change in the score. There's been progress made in relation to the management actions, but the risk we feel remains. It's one of those changing situations where actually the causation for the risk is different, and we resolve some issue and we discover new ones. And the latest position is that in the target operating model, we've changed the pathway, and that's a very deliberate thing that we've done. And until we are absolutely confident that that pathway has bedded in, we are reluctant to reduce the risk level for that one. So that's the reason why it's there. And we should always be concerned when a risk is on the risk register for a really long time and it looks like nothing is changing. And I guess what I want to reassure you of is that lots of things are changing, but the risk persists, but in different ways over time. And the latest being that we've introduced a new pathway, and we want that to be really strong before we let go and reduce this risk. The other one relates to financial sustainability. We've just had a finance conversation earlier, and although we're doing well, there are all sorts of system pressures and that Hugh might want to comment on, but that still sits at a corporate risk level. And finally, the third supporting risk is the one about assessing and discharging patients in a timely manner, and the implications that might have for adult social care. And you'll see a reference there that the acute system closed around 50 beds earlier in 2025. And we are, of course, very concerned and tracking the implications for adult social care, both in terms of our ability to discharge people in a timely way, but also from a financial point of view, in that if there's less capacity in the acute system, it is bound to have implications for adult social care. And we believe we are seeing some of those pressures, although we are still tracking those. So that was really it in terms of introducing the report. I'm very happy to take questions, unless Tom and Hugh would want to comment further.
Or not. You don't have to.
Always happy to answer questions.
Right, so do we have any questions on the corporate risk? So Councillor Clark, then Councillor Weston.
Just a really quick
Councillor
one.
Blake.
There is a sense of irony when you say about the risk of closing beds. 10, 15, 20 years ago, the conversation was all about closing the general hospital and closing beds down because people wanted to be at home and we wanted to be getting people back home. But there are definitely implications with that process to get people out. We know that obviously people's condition, they get deconditioned really quickly in hospital, but there are implications in closing beds, and we need to have the systems to support that, to get people out quickly and safely. But just the irony is not lost, really.
Well, I was just going to say I won't comment on that. That's probably not one that requires an answer from me. But what I would say is that I think it affects the resilience of the system overall. And at the moment, we have very, very severe pressures, the like of which none of my colleagues can remember. And it's not flu and respiratory disease. It's not seasonal in that sense. It is just a breadth of demand. And at the moment, the system is creaking.
I think just on the general point, I do get the irony. I think also though quite significant. There's been kind of quite significant increases in demand in recent years, and also there has been a net decrease in the bed base in Bristol and surrounds. And so I think people now say that actually we've got below the point that was originally speculated in the first of the Simon Stevens 10-year plans, and prior to that in regard to the reduction of the bed base in order to create much more effective community capacity. Second point is we've really got to create that more effective community capacity, and we've done quite a lot in regard to the discharge part of the system, but we really haven't. And very few places have done anything truly effective in regard to keeping people fit and well at home to avoid unnecessary admission, and that's the holy grail.
Councillor Weston?
Thank you, Chair. More just a comment, to be honest, on it. I mean, I have a feeling that these risks are going to be on here forever. Not because we're not trying to mitigate them, but actually the risk of failure is so large that actually there are a risk that carries on forever, because adult social services is so demand driven that I suspect that we will see these same things here in 3 months' time, 6 months' time, 12 months' time. I just make that comment for those people watching it. This is probably going to be fairly standard, I fear.
Point taken. Councillor Blake?
Thank you. So obviously I spent some time on the hospital board making decisions around closing the general. I won't go into the whole details of that, but basically, fundamentally, closing hospital beds is a good thing where you've got an efficient system, because it's much better to have care out in the community, proper funded care out in the community, where people actually want the care to be delivered. Right? So the big issue for us facing this is the hospital doing it because they're under massive pressure financially, so probably doing it for the wrong incentives. Still trying to get that right though, closing the right beds down, but are under massive demand pressures as well. And I'm not sure, and I guess this is going to provoke a question for me, is always that community side of it. They get the saving, but the community provision comes on us. They're also financially pressured and difficult to deliver. So I guess the question for me is, how much coordination goes on between us and the council around some of these decisions, and how can we perhaps ask for better coordination to ensure that somehow we if we don't, let me just ask the question, how much coordination goes on between us and the council when it comes to decisions like this?
Between us and the council, or between us?
Oh, sorry.
Yeah, I was
thinking.
So that's me going mad. Between us and the hospital trust.
Yeah, because that's one thing.
My apologies.
It's a bit feeble, but I am quite confident that between us and the council, we're quite coordinated. Fair play. In regard to the more recent closures, it was a risk-based decision that was that came upon the system almost within a low number of hours and had to be reacted to. So it wasn't really a decision that was made as a product of some strategic process. So very little in that regard. I think actually there is, in just to kind of develop the thinking a little bit, there is a strong national drive, governmental drive in regard to neighbourhood health, and the work that is very necessary to do, and building upon lots of good stuff that we've already done, to be fair, to develop more multi-agency coordinated and integrated neighbourhood activity. And I think we're about to start on a big drive on intermediate care, which I think will be one of the cornerstones neighbourhood health. There's also a lot of interest locally in regard to this concept of integrated healthcare organisations. And that's where kind of like you have a vertical integration and you look at a population health issue and you look at all of the organisations concerned and you have a lead kind of provider and they commission other activity from different sectors in order to meet those needs. I think that's very positive. I think there's a lot we can do to improve the very kind of issues about separateness that you've highlighted in the question that you raised. And I know that there's a lot of positivity from the new Bristol Hospitals group as they move ever closer together to do some of that work. So I think there's a lot of potential there.
And I think there's also a lot of challenges, because if you're moving from hospital model to community model and the funding doesn't go with that model, there could be some more challenges that's unforeseen, isn't it?
Absolutely.
Right. So so it's not all kind of all singing and dancing, I think, at this stage. Councillor Durston and then Councillor Y.
Thank you. Just on the adult safeguarding measures, this might have already come to committee in the past, but I'd be quite interested in seeing or finding out a bit more about what some of those changes to processes are and what they look like, and then what some of the impacts of those changes have been, if that's possible. Thank you.
Yes, I'm happy to briefly outline it. In essence, we have a large, complex system in the kind of social work and occupational therapy system, the statutory part of the system. And the change specifically relating to safeguarding is there's an activity, the jargon for which is called triaging. So that's receiving a safeguarding concern and reviewing it and making judgments about whether or not it goes forward to what we call the Section 42 inquiry, which is formally being treated as a piece of safeguarding. In the previous model, triaging would be happening throughout teams, and so you would have multiple points where that would be happening, with some. It was very difficult in a very large system to be standardised and to make sure that practice was happening in the same way and against the same thresholds all of the time. What we've done with the target operating model is implemented a larger safeguarding service where all of the triaging happens by a specialist team, so it funnels through that specialist team. This is more typical than not in local authorities to operate in the way that we've now adopted. And it means a larger safeguarding team. One of the bits of data that we've shared with committee previously is the volume of safeguarding concerns that we receive in Bristol, which is comparatively high. It doesn't matter who we compare ourselves with, whether it's core cities or the southwest or whatever. We have a really high level of safeguarding concern, and so that plays into the risk that we've got here, which is staying on top of that all of the time is a real challenge. And one of the reasons for not reducing the risk, and I know Councillor Weston suggested that perhaps this would be on here ad infinitum. I very much hope not, Councillor Weston, in that I think you're right that because of the potential impact of the safeguarding risk, it will always score highly because, you don't ever want to get that wrong. But I would like us to be in a more settled position where I was more certain, I guess, than what I am at the moment. So we would like to reduce the risk once the new structure has bedded in, but we don't feel that that's happened sufficiently yet for us to feel completely confident. So.
Okay, Councillor Y?
Yeah, not a question, just going back to bed base. Remember, we have got Health Scrutiny Committee, and if people want to put... I mean, we're done with our 3 for the year, but we have got a joint scrutiny coming up. I'm sure this affects the other authorities. People want to talk to me about formulating that into an agenda item, come and see me.
Okay. Right. So there are no decisions to be made. As this report, again, is for information. Thank you, Meta, for outlining the report. We've had our questions. So I would just like to conclude this item and for the committee to note this report. So I think we've had really good, robust questions today. And I'd like to thank everyone for attending. And just for your own notification, the next Adult Social Care Policy Committee is Monday, the 23rd of March 2026. Okay, thank you all very much.